Well, so at ASCO this year, there's a lot of important GI abstracts, gastric abstracts in particular, and also colon abstracts. So in the plenary session, before I present, you will see the result of the ATOMIC study, which is a randomized phase 3 study done through the NCI cooperative group in the United States, which is very important in this time of reduced funding and federal turmoil from science perspective, to see a cooperative group study that was funded by the NCI to be an important breakthrough is an important reminder to us that we are dependent on federal funding to support research. And this study looks for microsatellite and stable tumors with colon cancer with resected in adjuvant setting, randomizing patients with MMRD colon cancer to receive chemotherapy or chemotherapy with immunotherapy. Of course, we know that immunotherapy works in metastatic setting, but the role of immunotherapy in adjuvant setting has not yet been proven. So as you can guess, the fact that the study is at plenary, it shows that it's an important study, and I look forward to seeing the results of that. And in gastric cancer, particularly, the HER2 story also continues. Oral session that shows that TDXT randomized to second-line therapy, so it's a one-to-one randomization of TDXT versus paclitaxel ramucirumab, and it cements TDXT. It's a positive study, cements TDXT for use in second-line setting for HER2-positive disease. That study is important because the rebiopsies were mandated on the study before you start the treatment. So I'm excited to see that. And another second-line study, we've made a lot of progress in first-line therapy in gastric cancer. So to see all these second-line studies is good important. This was a claudin CAR T cell therapy study that looked at randomized for outcomes for progression-free survival of CAR T cell therapy versus second-line therapy. So again, should be very interesting to see. We saw a press release that it's a positive study.